Malaria is a serious and sometimes fatal disease caused by a parasite that commonly infects a certain type of mosquito which feeds on humans. A malaria parasite infection can cause a wide range of symptoms, from a total lack of symptoms to severe disease and even death. Malaria in general is a curable disease if it is diagnosed and treated promptly and correctly. Moreover, malaria disease can be classified as either mild or severe. Mild malaria is the typical but uncommon malaria attack that lasts 6 to 10 hours. It can be characterized by the following symptoms. First, a chilly stage, manifested by a cold sensation and shivering, followed by a feverish stage, where fever, headaches, vomiting occur, and finally, a sweating stage described by sweating, a return to the normal temperature, and tiredness. Moreover, malaria can become severe when infections are complicated by severe organ failures or abnormalities in the patient's blood or metabolism. The following are some of the symptoms of severe malaria. Cerebral malaria, which is characterized by abnormal behavior, loss of consciousness, seizures, coma, or other neurologic abnormalities. Severe anemia can also be a result of hemolysis, which is the destruction of the red blood cells, which further results into hemoglobinuria, which is the presence of hemoglobin in the urine. Severe malaria can also result in acute respiratory distress syndrome, or ARDS, which is an inflammatory response in the lungs that impairs oxygen exchange that can occur even after the parasites have decreased in response to the treatment. Severe malaria can also lead to blood coagulation abnormalities as well as low blood pressure as a result of cardiovascular collapse and hyperparasitemia, which occurs when more than 5% of the red blood cells are infected with malaria parasites. Further severe malaria can also cause acute kidney damage and diabetes mellitus, resulting from low blood glucose levels.
Plasmodium falciparum is a protozoan parasite that is one of the Plasmodium species that causes malaria in humans. This species causes malignant or falciparum malaria, which is the most dangerous type of malaria with the highest rates of complications and mortality.
In 2006, an estimated 247 million people were infected with malaria, with 98% in Africa and 70% being 5 years or younger. It is much more common in sub-Saharan Africa than in many other parts of the world. In most African countries, Plasmodium falciparum was responsible for more than 75% of the cases, whereas in most other countries with malaria transmission, other less virulent plasmodial species predominate. Plasmodium falciparum is responsible for nearly all malaria deaths. Nearly half of the world's population was at risk of malaria in 2020. Sub-Saharan Africa has the highest number of cases and deaths. However, significant numbers of cases and deaths has been reported in the regions of Southeast Asia, the Eastern Mediterranean, the Western Pacific, and the Americas.
Malaria is expected to affect 241 million people in 2020, with 627,000 people dying as a result of the disease.
The African region of the World Health Organization bears a disproportionately large share of the global malaria burden. In 2020, the region accounted for 95% of malaria cases and 96% of all malaria deaths. Children under the age of 5 are the most vulnerable group to malaria, accounting for roughly 80% of all malaria deaths in the African region in 2020.
Malaria can be acquired when bitten by an Anopheles mosquito, and the tests to diagnose such disease include tests to check the complete blood count or CBC, urea, creatinine, electrolytes, and blood glucose levels. And liver function tests should also be performed on a regular basis.
In non-immune adults and children, thrombocytopenia suggests both non-falciparum and falciparum malaria infections. Additional studies such as blood gases, blood culture, lactate, and clotting studies are appropriate in critically ill patients. Treatment for mild falciparum malaria should consist of one of the artemisinin-based combination therapies or ACT. ACT is highly effective because it affects a broader range of parasite life cycles, resulting in faster parasite clearance, and is thus considered the drug of choice for uncomplicated malaria. ACT treatment lasts 3 days. Other treatments, though less effective than ACTs, include atovaquone proguanil, quinine sulfate plus doxycycline, tetracycline, clindamycin, and mefloquine. Chloroquine is the drug of choice for chloroquine-sensitive Plasmodium falciparum infections.
Treatment for severe Plasmodium falciparum malaria is intravenous or intramuscular artesunate, which is the first-line treatment for all patients worldwide and should be used for at least 24 hours or until the oral medication is tolerated.
3 intravenous artesunate doses should be administered, 1 immediately, 1 after 12 hours, and 1 after 24 hours. If artesunate is not available, artemether should be used instead of quinine. It is critical to provide supportive therapy, such as glucose to maintain euglycemia and acetaminophen for fever control. As for patients with varying degrees of hypovolemia, acidosis, and acute kidney failure.
Severe anemia may necessitate blood transfusion. Benzodiazepines should be used to control seizures. However, prophylactic anti-epileptic medications are not advised, and in children with severe malaria and adults with concurrent shock, empiric antibiotics should be used.
Prevention of malaria is based on 2 complementary methods, which are chemoprophylaxis and protection against mosquito bites.
Due to the nocturnal feeding habits of most Anopheles mosquitoes, malaria transmission occurs primarily at night. Usage of insecticide-treated bed nets, application of mosquito repellent, spraying the residents with insecticide, and wearing of clothes that cover most of the body are the common measures against mosquito bites. There are some other ways to minimize exposure to mosquitoes. This includes some behaviors to reduce exposure, such as staying indoors from dusk till dawn and choosing screened accommodation. However, spraying insecticides and the usage of insecticidal nets prove to be the most effective control and elimination of Anopheles mosquitoes. Malaria chemoprophylaxis is recommended for travelers to malaria-endemic countries. There are several drugs, and these are prescribed after assessing the individual's risk, which include the level of local transmission, duration of exposure, type of travel and season, as well as the traveler's health status, its present contraindications, level of parasite drug resistance, and the nature of possible side effects.
Despite malaria being one of the most severe public health problems worldwide and a leading cause of death and diseases in many developing countries, it is preventable by using repellents, behavioral changes, chemoprophylaxis for travelers, and the usage of insecticides.